I'm Dr. Mo from Spark Sports Medicine. I'm going to do a quick look at the elbow exam here. So the first thing with inspection on the elbow, it's really about looking for any deformity. Using the other extremity is always important because not everyone's made the same. So when you have two extremities and you have some subtle swelling, a lot of times you'll miss that if you're not comparing it to the other side. So you take the affected side and you're looking for any sort of swelling over the UCL area, anywhere else, any deformities, some elbow, we see a lot of elbow fractures, whether it's the radius, the ulna, or the distal humerus here, and you should see deformities with those. So taking a look at all of that's really important. Is there a joint effusion? Is there bruising, ecchymosis, etc.? And then also just getting a sense of alignment as well when you're looking at inspection. From there, we move on to palpation. So one of the first places that I'll always palpate with the elbow is the medial aspect where the medial epicondyle is. And part of the reason is in pediatric sports medicine, we obviously see a lot of little leaguer's elbow. And the little leaguer's elbow is medial epicondyle apophysitis, or an inflammation of the growth plate right at the medial epicondyle. The medial epicondyle is a nice prominence. You can sort of get one finger on it right there and feel it. And as you bend and straighten, it rolls right under your finger. So that's a very important point and a good anchoring point to start with. And then as you go down from the medial epicondyle, you'll feel just underneath it and a little bit posterior to it the UCL, and that's a very important structure, the ulnar collateral ligament. We'll talk, and it's a little bit softer, so you feel I'm on bone, it's hard, and as I go right underneath there, you'll feel that you have a little bit of bounce there on the UCL, and then from there we go all the way down to our attachment on the ulna. So that's going to be one of the key structures with specialized testing that we'll want to be comfortable testing. Other areas to palpate, the distal humerus supracondylar access is very important to palpate. We see a lot of supracondylar fractures, particularly in young kids between 5 and 10, and so you want to make sure there's no pain here as you palpate the supracondylar transaxis there. And then coming laterally, the radial head's a tough spot to find, but the radiocapitellar joint, if you rotate the hand here, so if you go from supination to pronation, you'll feel it right under your finger, and that's a really good way to find it. And once you have that radial head, keep it in mind, it's deeper. You really need to do the motion to be able to find it, and then just above the radial head will be the capitellum. So radial head's going to be right in here, and I can feel it rolling right underneath my finger, and then the capitellum's going to be right above. It's important to palpate both of those because we see abnormalities of either the radial head or neck, sometimes fractures, and then the capitellum. We can see OCDs or osteochondritis dissecans of that in some of our throwers. So coming through the middle of the joint, you'll feel the biceps tendon and the brachialis tendon below that. Those are important to palpate to make sure there hasn't been any tears or ruptures. And then from there, rotating back to the olecranon, and we can sort of bend her elbow here, but the olecranon is also a very important one to palpate to make sure that there hasn't been any fractures or avulsions of that. There is a growth plate back there as well. The elbow is unique in that there's 6 different growth plates, ossification centers in the elbow, and so when you're talking about the pediatric patient or athlete, it's really important to be looking at all those different growth plates. So from there, we look at range of motion. The elbow is a hinge joint, so basically the main things you're looking at here is going to be extension and flexion. So you can see full flexion and extension here, and you can compare it to the other side. I will often have people do both at the same time to make sure that they're symmetric and how far they can flex and extend. And then obviously the other important sort of range of motion assessment here is going to be supination and pronation. And again, you have 2 extremities here, so we're going to look at full supination, full pronation. Let's keep you bent here, and looking to see if there's any asymmetries there as she goes from supination to pronation, and that looks good. So those are the inspection, palpation, and range of motion components of the exam.